Joining us tonight as Denver 7 presents Governor Jared Polis's address to the state of Colorado.
I'm Anne Trujillo. We will be with you for the next hour, first for the governor's address, and then afterward I will be hosting a town hall with 3 Colorado health officials answering your questions about coronavirus. And you can still send us those questions right now via email or by calling our coronavirus hotline.
So first, a quick reminder of where we currently stand in the fight against this virus. There are now at least 5,172 cases of coronavirus in Colorado. And on a call this afternoon, state health officials estimated that 17,000 to 18,000 people in Colorado are positive and added that testing only detects a fraction of them. 150 Coloradans now have died from this. Nationwide, more than 10,000 have died. And back here in Colorado, 994 people are being treated for severe symptoms in hospitals across our state.
And just this afternoon, Denver Mayor Michael Hancock extended the city's stay-at-home order until April 30th. And this graph gives you an idea of why that social distancing is so important. It shows the new cases day over day. There were 222 more cases than yesterday. And this is the curve that we're trying to flatten. And the state health department expects to run out of ICU beds next month if we do not increase our social distancing to at least 70%. And in an effort to flatten the curve, the governor asked everyone to wear masks in public by April 15th at the very latest. And many people aren't waiting that long.
I've been wearing it, for the past week anyways, just because I want to do my part as a young person and not be an asymptomatic person and spreading it to people that work at grocery stores and such.
Very nice man, very kind man. So under the current stay-at-home order, people are only supposed to leave for essential activities. Governor Jared Polis expected to address the state in just a few minutes. We are still not clear exactly what the purpose of his speech will be. This is the first of this kind, certainly an evening address to the entire state right now. We do know that the state announced today we have not yet hit the peak, but we're also very close, at least by my memory, in knowing just how effective this state stay-at-home order has been. Now live to Governor Jared Polis.
My fellow Coloradans, I speak to you this evening as we face one of the most dire and serious threats of our lives. Exactly 1 month and 1 day ago, we confirmed the first case of this new coronavirus here in Colorado. Since then, in just 1 month, even though it feels like a lot longer, it seems like it's overturned our society, turned everything upside down. The simple things that we like to take for granted have been taken away by a pandemic that shocked our state, our nation, and our world. It seems surreal. It seems like a cruel, ironic joke. Here we are, a state of people who love the outdoors, suddenly quarantined inside, told not to visit our majestic mountain towns and world-class ski resorts. A state with a booming economy, suddenly specked with boarded up windows and empty shops. A state of darers, dreamers, and doers, suddenly boxed in by 4 walls, a floor, and a ceiling. I know many of you watching this evening are distressed, frustrated, angry, not just because we're all stuck inside, but because we're unsure of what the future holds for ourselves and our loved ones. We all want a timeline. When will this nightmare be over? How will we pay the rent or mortgage? How can we keep the family business afloat? How can we keep our loved ones safe? Questions like these are keeping many Coloradans, including me, up at night. It's okay to feel this way. You're not alone. This crisis is impacting us all in so many ways. It's unlike anything we've seen before in our lifetimes. A severe public health emergency and a severe economic emergency hitting us at the same time. We can't live without an open and functional economy and market. People need to be free to engage in commerce and transactions, trade and work, but we simply can't function normally while we're living day to day in mortal fear of a deadly virus. The sheer size of this crisis has forced us to take a series of drastic measures that we would have thought unthinkable, unimaginable just a month ago. And in order to save lives and prevent more widespread economic damage, we need to continue to take bold action. The president and top national health experts at the Center for Disease Control have set a national goal of April 30th as the date that extreme social distancing measures like stay at home can likely end. I'm hopeful we can get things going sooner in Colorado. We're not just hoping, but working hard to be able to end as many of these devastating limitations on movement and commerce as quickly as possible. This evening, I'm announcing that our Colorado stay-at-home order is now planned to end April 26th, 2 additional weeks beyond the current order, several days ahead of the national goal. If there's any way to safely end it sooner, I will. And likewise, if Coloradans aren't staying at home and the numbers of dead and dying continue to pile up, could go longer. The reason for the April 26th date is simple, because the data and the science tell us that staying at home is our best chance, our only realistic chance to avoid a catastrophic loss of life, the death of thousands of our friends, our neighbors, our family members. We're fighting an invisible enemy, a virus that is both deadly and extremely contagious. The fewer social interactions we have with one another, the fewer opportunities there are for people to spread the virus to others, and the fewer infections we'll have in our state. We're also in a race against the clock, because if too many people get seriously ill all at once from the virus, our healthcare system simply won't have the capacity to handle all of those sick patients. Without an adequate supply of masks and gloves for our healthcare workers or ventilators for the critically ill, and without the testing supplies that we need for mass testing and effective containment, our only option is to limit the number of person-to-person interactions. Like many of you, I'm beyond furious that we've been forced to shut down large portions of our economy, putting tens of thousands of people out of a job, because as the wealthiest nation on the face of the earth, we still don't have access to the supplies and testing we need to mount a proper, more targeted response. I know that we would all rather be going back to work tomorrow instead of collecting government stimulus checks or unemployment insurance. I know that business owners will have to make even harder decisions this month. And I know that we all want this to end as soon as possible. But if the choice is between a temporary shutdown and a catastrophic loss of life, the choice is clear. These closures and restrictions will be temporary, but when you lose a life, you lose it forever. And in fact, the economic consequences would be even more severe and more prolonged if we completely overload our hospital system. The longer this economic paralysis lasts, the fewer jobs there will be to return to, and the more difficult the recovery will be. Thankfully, a silver lining is just beginning to emerge in Colorado. The data is telling us that thanks to the actions we've taken and you've taken, we're starting to make progress. At the beginning of this crisis, the number of positive cases in Colorado was doubling every 1.5 days. Today, the number of positive cases is about doubling every 6 to 7 days. That means the spread of the virus is beginning to slow. This is a remarkable achievement by you, the people of this state, and I want to thank each and every one of you who's been taking this seriously and staying home. You're truly helping to turn the tide against this deadly virus. This is not the time to abandon what's been working. Quite the opposite. We need to keep up the good work for a while longer so we can eventually return to a level of normalcy in our economy and our society. That means washing your hands frequently with soap and water, wiping down surfaces, avoiding touching your face. Most importantly, we need to stay at home and not go out unless it's absolutely necessary. And when we do go out, you need to stay at least 6, 8, 10 feet away from others and wear a cloth facial covering or a mask when you absolutely need to leave your home. And you don't need to buy a mask or even buy craft materials for one. You can simply make one from an old t-shirt or just use a scarf. Really, any facial mask that covers your mouth and your nose works as long as it doesn't interfere with your own breathing. By following these steps, you're saving lives. Could be the life of your grandparent, your parent, your aunt, your uncle, your cousin, your child, your friend. It could even be your own life. The better job we do of staying in, the sooner we'll be able to go back out. I know this isn't easy, but if we all do our part, we can beat this virus and get back to living our lives. Earlier today, I spoke with a family where both parents, Andrew and Christine, both children and both maternal grandparents, were all sickened with coronavirus. 5 out of 6 are fully recovered, and we hope that grandma is well on the way to feeling better. They told me that the virus impacted each member of the family differently, and the outcome could have been different if they didn't have access to medical attention. Now look, 80 to 90% of those who get this virus won't need medical assistance, but between 10 and 20% will need hospitalized care. Right now, by using this valuable time to prepare for this coming surge in patients, we can make sure that everyone who has a chance to make it gets that fighting chance. We're moving heaven and earth to ensure that our healthcare workers have the gowns, the masks, the gloves, the face shields to keep them safe. Because they are our heroes. They're the ones who will take care of us when we're sick, and we owe it to them to keep them healthy. We're building more hospital beds and working to acquire more ventilators to make sure we have the capacity to handle the projected increase of severely sick patients. And I want to thank Colorado hospitals and the Army Corps of Engineers for constructing hospital space to meet the needs. Finally, we're using our creativity, our innovative, scrappy, and independent spirit to obtain more tests so that we can have widespread testing and containment like South Korea and Taiwan, who've been able to successfully return to a level of normalcy by testing, quarantining and isolating individuals instead of quarantining an entire society. Recovery from both the virus and the economic devastation is possible, and we will get there. But all these efforts will be in vain, and many lives will be lost if we fail to do our crucial patriotic duty and stay home. By staying home and wearing a mask when you have to go out and practicing distancing and good hygiene, you're literally saving lives. The need to limit interactions is so great that the federal government is literally paying us to stay home. If you make up to $75,000 as an individual or $150,000 as a couple, you'll get $1,200 per person. And no matter what your income level is, you'll get $500 per child age 16 and under. This is not free money. The federal government, President Trump, Nancy Pelosi, Mitch McConnell, almost the entire United States Congress agreed that paying Americans to stay inside is needed to prevent a full-scale disaster. You need to earn this money by staying home, except when absolutely necessary to go out. The federal package also includes an incentive for companies to keep you on payroll, even if you're not able to go to work, to prevent even worse layoffs. On the state level, my administration is suspending regulations, deferring tax payments, eliminating red tape and in-person requirements for many license renewals, and working tirelessly to ensure that we're supporting our businesses and our workers as we all weather the storm to ensure a speedy economic recovery when this is past us. What matters now is not what you believe politically or your occupation or what your faith is or your age or your race. None of that matters here because none of that matters to the virus. What matters is that the more we stay home, no matter who you are, the better chance we have of beating this virus so that we can all go back to the things that make life worth living. Look, I know this isn't easy. I know Coloradans are hurting, and this is no ordinary emergency. We faced crises before, floods, fires, recessions, but this one is uniquely painful because we can't be with one another. This April will always be known as the lost month. We all have the blessing of being on this planet for 900 or 1,000 months in our lives. And we won't get this one back, but if we act together and take action, we will have many more to live in prosperity and health. In times of tragedy and difficulty, humanity comes together in fellowship. We mourn and we celebrate together. We laugh together and we cry together. We find comfort in the company and the love of one another. Now, we can't do that right now physically, but that doesn't mean that we can't be with and don't need to be with one another emotionally. Use this time to reconnect with friends and family and loved ones. Thankfully, there's been amazing progress in how we can stay together even as we stay apart. Email, phone, Skype, Zoom, FaceTime. We can see and hear our loved ones none of this is permanent. With time, we'll have more hospital beds and a mass testing and containment program in place, and the spread of the virus will be limited enough that we can get back to a fairly normal economy and society. There will be a day in the not too distant future that we can physically be together once again, when we can go to bars and restaurants, attend schools and universities, churches, temples, and houses of worship, when grandparents can hug their grandchildren without the fear of getting sick, when we can once again feel the wind against our face as we ski down our favorite ski runs and hike our favorite trails. But that day is not today, nor is it tomorrow. Right now, we need to dig deep into our souls to muster the resolve, the courage, the fortitude to carry on and do our patriotic duty as generations have done before. Thousands of our forefathers sacrificed on battlefields defending our freedom, our homeland, our way of life. Thousands of our foremothers sacrificed pots and pans and farm equipment to be melted down for the war effort during World War II. People had ration cards to save food for the troops. We banned men's suits from including cuffs and restricted the length of shirts to save fabric. Everyday citizens became heroes. Ordinary men and women became G.I. Joes and Rosie the Riveters, everyone working together and doing their part. We scraped and toiled and persevered, and we won. That is the spirit that we all need right now. This generation has been called upon to make our own sacrifice, to temporarily sacrifice our way of life so that we can save human life and return to normal. And I know that we can rise to the challenge once again. A number of communities across the world, including some right here in Colorado, have taken up a new tradition of going outside for a moment at 8 p.m. to applaud and cheer our brave healthcare workers who are putting their own health and safety on the line to keep us safe, and everyone else who's helping us through this crisis and putting themselves at risk. Our first responders, our farmers and ranchers, our journalists, our custodial workers, our grocery store workers, delivery people, truckers, so many more. I want to encourage Coloradans to participate in this new tradition this evening and every evening this crisis is with us. Our appreciation for those putting themselves at risk unites us across the world. And the only way we're going to get through this is by working together as a state, as a nation, and as a world. Both China and Taiwan are donating masks and protective equipment to Colorado. Israel even delivered masks to Palestinians. And let's also cheer our very own scientists at Colorado State University who are racing around the clock for a vaccine or cure. And when we achieve that cure or vaccine, and I say when, not if, whether it comes out of Germany, South Korea, Japan, or Fort Collins, it will be shared around the world to end this crisis and save lives. I might not agree with Henry Kissinger on much, but I found his recent words in the Wall Street Journal very profound. He said, quote, "The pandemic has prompted an anachronism, a revival of the walled city in an age when prosperity depends on global trade and movement of people," end quote. Colorado and America is not a walled city. We will survive this and return to health and prosperity by embracing the world rather than shrinking from it. And through this crisis, we'll reaffirm our identity as innovative, resilient, good-hearted people who care for one another. St. Francis of Assisi once said, quote, "All the darkness in the world cannot extinguish the light of a single candle," end quote. In these dark times, we all have a light to shine, and that light is the goodness within all of us. We see that light in the young man who picks up groceries and medicine for an elderly neighbor so they don't have to go to the store and risk getting the virus. We see that light in the small business owner keeping her employees on payroll because it's the fair and decent and right thing to do. We see that light in the parents who do their best to explain these difficult times to their children and making sure they know the truth of that wisdom, that a single candle is enough to light the dark. We see that light in the teams of doctors and researchers and scientists spending week after week in labs all over the globe, burning the midnight oil, showing that light, searching for the cure to save the world. We need everyone to do their part. We need everyone to show that light. And when we do, as I know we will, we'll find our way out of this darkness and into the light of a brilliant new day. Thank you. God bless the great state of Colorado, and God bless the United States of America.
Governor Jared Polis calling on Coloradans to stand up and stand together as we figure out how to deal with this coronavirus, basically saying we will survive this together, yet at the same time saying that we need to follow the rules. And I think one of the bigger issues that he said today is that it's time to extend the stay-at-home order until April 26th, and truly could do it earlier if people follow the rules right now. And as you know, he has asked people to put on their masks, start wearing their masks as soon as possible, set a date of middle of the month, but giving us some time to get our masks in order. We're going to take a short break and be back with our guest from the Colorado Department of Health.
Yeah, just scoot over that way a little bit. I just need, can we move this a little bit so it's just not, that monitor is just like this. Okay? Somewhere like this, maybe. So you can see a little bit of the monitor because it was just like this weird.
Okay, everyone, if you can...
Speakers horrible.
There we go. I see everyone now. And still on mute, some of you. Dr. France and Dr.
I think that's off. So it would certainly be a balance. We're trying to minimize exposure and minimizing the risk both for you as well as for the healthcare workers that care for you.
Well, and we do have a question about frontline workers. This is in a voicemail, so have a listen.
I'm a very concerned father with firsthand information that want to know why my daughter and her coworkers at Denver Health, frontliners, are in constant need and are constantly worried about the basic PPE that they're not being provided. Every day my daughter tells me it's getting worse and worse. 7 days she's using the same mask. This is unacceptable. We need to get our stuff to the frontline people. Without them, we're done.
Well, you can clearly hear the concern in that man's voice. So what do you think?
I think it's very important that we're protecting our frontline providers with the necessary personal protective equipment. And it's clear that the supply isn't what is needed. There is use and reuse of material. There's cleaning and re-cleaning of the material. There's concerns that going into one exam room, I could potentially carry something of a bacteria from that room to another patient because I can't replace the material I'm using. So there are real concerns. When we know that there is a mismatch between the care that needs to be provided and the resources available, we move out of our conventional standards of care and we move into what we call the crisis standards of care. And the state of Colorado has a committee that makes recommendations to the government about emergency epidemics, and just yesterday made recommendations around crisis standards of care for personal protective equipment, for hospital care, for emergency services. And when we're short on resources, we have to practice differently. The best to our standards, but they are certainly different as doctors when we don't have the material that we normally need. So we have a standard for personal protective equipment. It not only provides information about different options about how to use the supplies that we have, but it also provides liability protection for healthcare workers and healthcare institutions during a time of crisis when reuse is required.
Well, and to that point, do we know how long the virus can stay on clothing, for example, or on surfaces?
Yeah, so it is different from surface to surface, but we do know that the virus can survive from hours to days on different types of surfaces. And that's part of the reason it is so important to ensure that appropriate cleaning is taking place, certainly in our healthcare settings, but also in stores and our homes as well, making sure that we're routinely cleaning high touch surfaces. It's a really important strategy to prevent transmission of the virus.
So there's no known precise time. I mean, does it last 2 hours or 10 hours or?
It is different. There are some estimates out there, but it's really different from surface to surface and from environment to environment.
Can we talk about chloroquine or the anti-malaria drugs that are out there? What do you think about that? Is that a possibility? And I know that's also created some concerns for lupus patients, for example, who are concerned that this drug is now not as available as it once was. What do you think about all of that?
There's this question about whether the anti-malaria drug chloroquine might help, and I think a small study involving 60 people suggested that there may be some value. It was, again, a small study, and so whenever we find a new therapy that is promising, we have to do the formal research. In particular, there's always the question about, does it work? But in my mind, what's even more important, is it safe? Could it potentially be doing harm? So as we're trying to do what we think is right for people, are we actually causing harm? And the only way you really get to that is if you do the proper research. My concern with chloroquine, too, is that hydrochloroquine is that there could be a run on this medicine at our pharmacies. There are medical conditions where this, other than malaria, where this is an important therapy, and autoimmune disorders, for instance. And so I worry that persons who actually need it for good reason may not be able to get it because people become frightened and ask their physicians to write them prescriptions. So we're looking at that at the state about whether there's a problem in our state. I would ask all the citizens of Colorado not to try and stock up with chloroquine. We need to have that medicine in the hospital to take care of people who are ill, have them enrolled in trials so we can see if it actually works. And then if it does work, make sure that we have the supply we need for those who are most ill and would most benefit from it.
And Dr. HERLIHY, I hear from a lot of people who say, what's all the fuss about more people die from flu than compared to coronavirus?
Yeah, so there certainly are similarities between influenza and COVID-19, but there also are significant differences. One of the things that we know about COVID-19 is that it does tend to be more severe than influenza. We are certainly seeing that older adults and adults with chronic medical conditions are those that are hardest hit by COVID-19, and that's similar to influenza. But when you compare something like the case fatality rate, so that's the percentage of people who develop the infection that die, that percentage is higher for COVID-19 than it is for influenza. And this virus is also another measure of the virus that we are tracking is how transmissible this virus is. We also believe this virus is more transmissible than influenza. Certainly influenza is a very severe illness, but from the measures we have, that there are a number of factors that suggest that COVID-19 could be more severe and more transmissible.
Okay, let's go to another voicemail. This is from a viewer who has some concerns about restaurants.
Yes, my question is, going through drive-through restaurants, is that safe? And is there anything to make it extra safe, like, just cracking the window or something? Thank you.
I think that's an example where we're asking people to wear masks out in public, so that'll provide another level of protection, and all the prevention measures that we're used to, like washing your hands. So when you've been out and about, running errands, going through a drive-through, going through the grocery store, it's really good to practice proper hand washing techniques. It is one of the most effective ways to prevent the spread of disease in general.
A question, what are the chances of this happening year after year? Again, looking at how we handle the flu. Is this going to be a problem next year and the year after?
Yeah, it's too soon, I think, to know. There are other coronaviruses that do frequently circulate and are seasonal viruses just like influenza. So these are viruses that we see every year in Colorado in the winter time. It is quite possible that, as the number of people that get this infection become greater and greater, that transmission will slow down, but we could potentially still see cases that occur year after year. I think it's too soon to really know if this is going to be an epidemic that occurs and then is gone, or if we'll continue to have some lower level of transmission into the future.
We have another voicemail question about masks. Let's listen. Oh, my apologies. We don't have it, but let me just read it to you. If you have one N95 mask and you wear it, can you wear it multiple times without a problem? And if you keep it, like in a paper bag or a plastic bag, I guess the question really is, are they reusable?
So during a time of shortage, certainly the N95 can be reused. It's not the ideal. So in medical care, we would typically use the N95 and then discard it. In today's shortage of N95s, they are being reused. Some of the key ideas is to not put your hands on the front of it in any way. The N95 is a special kind of mask. It's called a respirator, and it actually fits very nice and tight across the nose and the chin. And to wear it appropriately, it's actually professionally fitted. So you have a fitting of the N95 respirator, just to be sure that indeed it is covering everything as it should. The N95 can be removed by just holding the straps behind it without touching the front. And then it can be placed in a brown paper bag for storage, always trying to be sure that when you do use it, you do not touch the front of it, because if indeed viral or bacterial particles are sitting on it, then you could pass it in your fingers.
All right. On that note, we are going to take a quick break, but we will continue our conversation with Director Ryan, Dr. HERLIHY, and Dr. France, and we'll be back right after this quick break.
Getting back to normal would be like, like trickling out? Do we just go to restaurants again? I mean, how do we see that transition? I just didn't quite get it in the first one. As a statewide, maybe it could be a good way to look to more positive things. Like, how does getting back normal look? Yes. Simply.
We're 1:30 away, everyone. We're a minute away. Okay, and we'll have about 7 minutes total when we come back. Thank you all so much. You've been great and so patient. I appreciate it.
Sorry, I didn't know this went out because
And welcome back, everybody, and happy to have the state's top medical officials with us here to answer questions from viewers. Let's talk about shared spaces for a bit. There's a lot of folks who live in apartment buildings. Is it safe to use the laundry? Is it safe to use the elevator? What do you think about those questions?
Yeah, I think, it's important, I think, to keep in mind the social distancing strategies that are being recommended. So certainly if you're going to be in shared spaces, wearing a cloth mask is a great idea. I think perhaps think about going to the laundry facility during a less popular time and trying to maintain that space between individuals. Obviously, hand washing is always going to be a really important strategy, or carrying some hand sanitizer with you when you go in those common spaces. And I think to building owners that own those spaces, it's certainly important to make sure that cleaning practices are in place. Sure. And that high touch surfaces are being cleaned.
I've got a message from Cole who asks, if two groups of people have been isolating for 2 weeks now, have no symptoms, can they get together? And how, or, what advice do you have for, like people who share custody of their kids?
Yeah, so we know that asymptomatic transmission can occur, and that individuals can also be asymptomatic for a while before they develop symptoms. And so there is always the possibility of transmission occurring and individuals not knowing that they've had an infection. So I think it's important to keep that in mind. Obviously, for shared custody situations, it's important for children to continue to have a routine and to see both parents. I think it's just, making sure that both households are practicing social distancing and, maintaining a safe household for that child as much as possible.
When do you all think realistically we'll have a vaccine ready?
Well, I think the estimates are all pointing out to at least a year. Recognize that it's one thing to say people are starting to do the research, but then they go from trying it on a few people to trying on a group of people to trying it on thousands of people to make sure it's safe and actually works, and all that takes time. So to say 12 to 18 months, given all those steps that are required, seems reality. There may be experimental vaccines available earlier, and there may be parts of the country that the experimental vaccine would be available. At that point, we wouldn't know if it worked, and but we'd certainly roll up our sleeves to do our part to help come up with the vaccine. But I think it is realistic to say it's going to take a year and a half before there'd be something widely available.
And what percentage of Coloradans can you even say who have recovered just fine from coronavirus? Do we have those numbers?
You know, oh, sorry, Eric.
Go ahead, Joe.
I'll just say this: the School of Public Health gave us some estimates that we believe between 17,000 and 18,000 people have been symptomatic with COVID. So those aren't folks that have necessarily been tested, but that's their estimates on how many people have actually been sick. It doesn't take into account people that are asymptomatic.
Dr. France, did you want to add to that?
Just that indeed there are going to be some percentage of people who don't have any symptoms at all, and that will be particularly difficult to then track them. But you can see it's quite a small percentage. Less than 1% are assumed to have been infected to date, which is all the more reason for us to follow our physical distancing rules now as we stay at home. And I think even when the stay-at-home orders are lifted, we'll be paying more attention about our physical distancing, knowing that this virus is still out there and there are people who are vulnerable to serious infection should they acquire it.
And are there other drugs, do you know of, that are being looked at right now other than the antivirus?
There are antivirus medicines that have actually been tried on the compassionate use, both in the United States and elsewhere. There are formal trials where people are randomly assigned to receive these medicines and looking to see if people get better should they get it. And my hope is that we'll have data coming out in the next few months that will help point us to whether or not these antivirus medicines that have been used in other virus infections might actually work with this virus.
Okay, so we have about 2 minutes left. We know that the stay-at-home order is until April 26th. What does it look like? And I'm going to ask all three of you, what's it look like to get back to normal? And what will our new normal look like? And I mean, I just want to end on a positive note that this will end at some point, right?
Well, certainly we will keep evaluating through the modeling data what level of social distancing is needed. There will probably be some level of social distancing needed for quite a while, just again to make sure that the virus is moving slowly enough as to not overwhelm our healthcare system.
Dr. HERLIHY?
And I think it's also ensuring that we have those resources in place in public health and our healthcare system to manage cases as they occur. And really those strategies together with social distancing, I think to a lesser degree of social distancing will allow us to resume more normal life.
And Dr. France?
Certainly hopeful about all the new behaviors that we're picking up, families spending more time together, spending more time outdoors, walking dogs, outside on bicycles, staying physically distant, but not socially distant. I think we will find ourselves in a world where there will be distance, but we'll be still engaging with friends and family.
Well, I think we are all hoping that we get back there sooner rather than later. Again, the order goes until April 26th, but I think what we heard from the governor tonight is that we will survive, and on what timeline, we are all hoping for the best together. So I want to thank you all so much, Director Ryan, Dr. HERLIHY, Dr. France. Thank you so much for your time and your expertise. We appreciate you all for joining us and watching here on Denver 7. Have a good evening.